universal distribution of the nets is very important to control the malaria. Kagadi district is the one that is experiencing more cases of malaria as compared to other districts like Hoima, which had already gotten the mosquito nets.
On the pre-distribution phase, we come and register the number of households that are in that particular district. We allocate nets to the people in a given household.
We went for the training at the town council headquarters, and we were sent back to our villages to register everybody moving house to house for 3 days.
Obunabagambire ngu ntuza kutunga obutimba bw'emibu nayongera nabasoboraho ebirungi ebiri mu kukozesa obutimba bwaki bw'emibu obuturamara kukoraki kubutunga.
When we have registered all the people, then we come back and start distributing the nets basing on the allocated data. 1 net per 2 people.
This is a way bill, and this is how we keep track of the nets. The store manager releases the nets in total, and these are the total of the nets of the particular villages. Now here we'll have the total number of nets that have gone in the entire ward. The LC chairperson of where the distribution points are has to acknowledge that we have received a certain number of nets in his area.
We try to take the nets before the day of distribution. Certain circumstances might fail us because the roads in this district are somehow insurpassable. People come to the given distribution centers to collect the nets.
In Uganda, we know the importance of cultural leaders. They play an important part in driving change or resisting change. So we made sure that political leaders, religious leaders, health leaders bought into the campaign and led from the front to make sure that people got nets and used them. Then the second approach is mass media. We had radio, we had TV, the trucks with loudspeakers and people talking to the audience and moving around the villages to mobilize them. He took the message and took it down to the people and made it more personal, and people would then, 1, register for the nets, 2, use them, and then continue using them. During the net distribution, we had teams of health communicators at the distribution point demonstrating how to use nets correctly and consistently, and how to hang them up and how to take care of them.
This tally sheet is supposed to capture the number of nets each village has got. At the end of the exercise, they'll bring them back to me, and then we'll go and reconcile at the head office. So we train all town council leaders to take back this training down to the grassroots.
So this one is helping us to know the number of nets we have given to the people in our village. From morning up to this time, we have distributed 200 nets.
In this area, they have decided to distribute the nets via the window because of crowd management. Each of the window is being designated as a village.
We are good? We are good.
Ekiyomugasa kimanyi kufuna katimba wetangira omuswiji. Hawakuba kusinga ofuna omuswiji agensire gobonabona muna okanyonka gufunako.
Ninja kulenga okubulinda kurungi na buli batugabire nkyabwine. Nimbukwata kurungi bokwanyi kintu kyomuhendo.
So far, we have achieved tremendous success today. By 6 p.m., we will have achieved around 98% of the nets that are being disputed.
With the use of the mosquito nets, it has contributed reduction in the number of cases of malaria which comes to the health facilities.
In total, the campaign reached 116 districts, 1,500 sub-counties, about 8,000 parishes, close to 60,000 villages. So it's about 10 million households reached by the campaign. It's enormous.
The campaign has taken over a year and has created foundations and inroads with the different leaders. So any other project taking over this will benefit from what has been established by the universal net coverage.
This universal coverage happens every 3 years. Now we also have to have continuous coverage, and we have to have targeted coverage at the health clinic level, where pregnant women get a net when they come in for their prenatal visits. And when the newborn child gets a certain number of vaccinations, all those are part of the system that makes sustainability of coverage of nets possible.
People are willing to buy the nets, and we tell them that the material that you are getting in the shop is the same material that we have been distributing. And maybe in our health promotion, we need to advocate that they don't have to wait for what is coming from government, but they can still buy from the shop, because malaria will also not wait for them.
Ensuring that those who can afford actually can get to the private sector and buy nets. Once this is strengthened, it should even be able to help the country move away from the enormous need of the mass campaign.
Hati nyowe ekinkwendeza malaria ekinkugendereza kimu ninyendera kimu tugubingira kimu omuswijja gugugendere kimu gutalyongera n'okutukwata.
You